Hey, what's up? It is Babs from Wow 94.1, the midday show, and today I am here with my good friend Darius. What's up, Darius?
Hey, Babs.
Hey, how you doing? You doing good?
I am doing wonderful. How are you?
Good. Now, you know what? The conversation that we're about to have can be very taboo for some people, and a lot of people like to shy away from these topics. But spring break is coming to an end, and we definitely need to talk about this. Now, tell the people where you work and what your title is.
So, I work for the Pinellas County Health Department, and I am the HIV/AIDS program manager for all HIV and AIDS program-related activities in terms of the health department.
Now, are the cases on the rise here in Pinellas County?
Yes, we did have an increase in the number of new HIV cases within the last year in our county. Specifically, we have seen an increase in our 20 to 29-year-old age group. We've seen increases in our 30 to 39-year-old age group. It even is a little bit in the 50 plus, believe it or not. But to 20 to 29-year-old age group, that is where we're seeing just a mega explosion of new cases.
Is that the only group of people that are being affected like in a big way right now, or is it any other communities that are being affected?
Well, if you want to look at it in terms of demographics,
Yes.
And where people live in this county, the majority of those new cases are in the African American community, and specifically within the city limits of St. Petersburg. I'm talking zip codes 33701, 33705, 33711, 33712, 33713. That's not to say that we don't have cases in other parts of the county, because we do.
Right.
But what we're seeing is a large concentration in South St. Petersburg.
Now, I'm a resident of St. Pete, and I am very happy to partner with you guys so we can stop the cases from rising. Now, how can we prevent more HIV cases here in Pinellas County?
Well, first we've got to do more things like what we're doing now. We got to have conversations. We can't be afraid to talk about topics like this, because what you don't talk about can hurt you. And many people think that if they don't talk about it, if they don't go get tested, that they don't have to deal with the reality of this particular subject. And what we have seen in many cases is, if you don't deal with the virus is going to deal with you.
Right.
Right. So how would you recommend that? How often should someone get tested for HIV, should I say?
Me, myself, personally, I did it every 3 months. But, some people do it every 6 months. I think it really depends on you and what your level of activity is.
Right.
Some people may be in a committed relationship, and I say that with a little skepticism, because I've learned down through the years that just because you're in a committed relationship, it doesn't mean that the other person that you're with is in a committed relationship.
Oh, tell me about it.
And so I think it really depends on you and being honest with yourself and what your level of activity is, whatever that may be, whatever it is you're doing.
Yeah, absolutely. Now, tell me a little bit about the Pinellas County Ending the HIV Epidemic Initiative.
So the Pinellas County Ending the HIV Epidemic, or what we more commonly call EHE, last year, the U.S. Department of Health and Human Services identified, I think, roughly around 48, 49 counties. They looked at counties and they looked at territories across the nation that have substantial burdens of HIV. In Florida, we have 7 what we call jurisdictions. Pinellas County is one of those 7 jurisdictions where we have a substantial burden of HIV cases. And when I speak of that, I'm not only just speaking of new cases, but I'm speaking of just the number of people that live in this county that have an HIV or AIDS diagnosis.
Right. Now,
Now, where can people go get tested here in the county? Do you guys offer free testing at the center?
Yes, we offer free HIV testing at all of our county health department locations. Several of our community partners, such as Metro Inclusive Health, AHF, Impact Partners in Care, the Bird Cares, Banyan Tree, Help Us Help You. There are so many places in this county where people can go get tested, and it doesn't really cost you anything. The only cost that may occur, for example, some places do like what we call like a complete panel, where they're not just going to test you for HIV, but they're going to test you for STDs as well.
Right.
Because their HIV and STDs, sexually transmitted diseases, are very closely related, and often sexually transmitted diseases or sexually transmitted infections are the gateways to HIV. So if you're someone that has contracted gonorrhea or chlamydia or syphilis, those are oftentimes gateways to HIV infection.
Right. Now, okay, so let's say I'm out, I go home with a guy, I sleep with him unprotected. Same night, later on that day, week, I find out that I could possibly have been exposed to HIV. How soon do I go get tested, and will I know the results right away?
Well, I think if you didn't know him, that is what we call a post-exposure.
Okay.
If you woke up the next morning, you thought, "Oh my God, what did I do last night?" We didn't use protection. I don't really know him.
Right.
I don't know anything about him. That is what we call a post-exposure, meaning after the fact. There is a 72 window time frame in which a person could go to the ER clinic. They could see a licensed physician and get a prescription, which would be a pill that they would take. They still would probably need to get tested for HIV within 30 days. We do with some of our testing, we have what we call rapid testing, where you can get a test result in about 15 minutes. Now we have instant testing. In many cases, you can get a result back in less than a minute. But I want to point out, if you went out last night and you slept with somebody last night and you went and took a test today, no test is going to show that. Usually with HIV infection, it's going to take a couple weeks before it shows itself.
Okay.
So it's not like you can just go out and do what you want and then the next day go take a test.
Right. Now the pill you were speaking of, what is this pill for?
So we have two prevention interventions.
Okay.
Okay. One is PrEP, which is pre-exposure prophylaxis. And then we have PEP, which is post-exposure. Now, what you referred to earlier, you go out to the club, you meet a guy, you go home with him, you didn't really know him, you have sex with him. That's what we call a post-exposure. A pre-exposure to me is if this is your normal behavior. If you're someone, for example, let's say you're a sex worker.
Okay.
Okay. Or you just have more than one sexual partner on a regular basis.
Right.
If you are someone who is in a relationship, maybe one person has the HIV diagnosis and the other person doesn't. That's what we call a serodiscordant relationship. That could be a circumstance in which a person may qualify for PrEP. So the difference is, to me, okay, is this a one-time isolated incident? Is this something that has happened after the fact? Or is this just my normal behavior? This is something that I do on a regular basis.
So if it's a normal behavior, you recommend that they take the PrEP?
Well, I would recommend that they be screened for
Okay.
PrEP. And with PrEP, there are a few things. First and foremost, they're going to give you an HIV test, because if you already have HIV, you can't take PrEP. PrEP is a prevention intervention that is for people who do not have an HIV diagnosis. So the first thing they're going to do is test you for HIV.
Okay.
Okay, if the test result comes back negative, they're going to get a little personal. They're going to get all up in your crowd. They're going to get all up in your business and ask you all kind of personal questions.
Right.
You know, who you've been with. You know, you might not want to tell who you've been with, but what you've been doing and how do you like to do it? And, you know, how often are you doing it? You know, they're going to do some lab work. They're going to look at your kidney function, and they're going to look at your labs, because they want to make sure that they don't give you anything that's going to adversely affect you.
Right.
PrEP is it's not meant to be a magic cure-all. It's not a pass to go do whatever you want.
Yeah.
It is a prevention tool. It's supposed to be used in conjunction with condoms and other safe sex practices to basically prevent you from catching HIV. Now, I always like to point out that it's not going to protect you from STDs. It's not going to protect you from gonorrhea or any kind of other STD. So you have to keep that in mind. That's why we always tell people, use condoms. Condoms are our friends. We We buy so many of them. We buy them. I mean, we spend millions of dollars every year buying condoms.
So one could just come pick up condoms from you
can
guys
come
for
get
the
condoms.
free.
We got every kind that they want.
Now, a question real quick. So we talked about the PrEP. Now the PEP, the one that you said that if you're exposed and you go get, you go to like the urgent care or something the next day, does the PEP, will that flush everything out of your body?
No. What it will do, if there was a exposure, that medication will work to counteract that exposure.
Okay.
That's provided you get it within that 72-hour time frame.
Right.
So theoretically, you should not acquire HIV infection unless, of course, you already had the infection prior to the post-exposure, and maybe you just didn't know that.
Right.
Which is why it's so important that if you're sexually active, that you're getting tested regularly.
Right. So, okay, if someone's listening right now, besides wearing condoms and being safe in that aspect, what can we do to stop the rise of the numbers in the cases here in Pinellas County? Like, what can we each do as individuals?
One, we got to start having conversations about sex.
Okay.
If you're seeing somebody, and I think some of it is, some of our generations now, they're not necessarily dating, they're hooking up. And even in that, if you're gonna hook up, Tinder, Tag, Jack,
Right.
Grindr, if you're gonna, they even hooking up through Facebook and Instagram.
Oh Lord.
Yes, Lord, them inboxes be popping. So if you're going to engage in sex, have conversations, and a lot of this is that people are not having those conversations. They're just linking up. They're having sex. You don't have to know anything about the person's history. And a lot of times people are not going to be honest with you in some instances.
Is it illegal to not tell someone that you have HIV before having sex with them?
As it currently stands in the laws right now in this state, I believe it's a 3rd-degree felony.
Okay.
It may be. I do know it is illegal to engage in sexual activity with someone without disclosing your status, and that is kind of whether you have sex or not, because you can have one kind of sex and not have another kind of sex and say, that we didn't have sex. I did not have sexual relations with that woman.
Right.
But you might have did some other kind of, stuff. And so, for a person that is living with HIV, and what we understand is that there is so much stigma in this community about that topic. People are, in many instances, afraid to disclose that information for fear that that information is going to be spread around, that they're going to be ridiculed, that they're going to be talked about, that people are going to look at them differently. For some people, that is tied into their mental health issues. There may be domestic issues. There may be any number of different kinds of issues, and so we understand why that conversation is difficult to have, but
we gotta have it.
But you have to have that conversation. Yes, and so what I want to just encourage the people to do, particularly our young people, the 20 to 29-year-old age group, because that is where we're seeing so many new cases. In many instances, when we talk to people, when we interview them, when we're trying to get a history of, where that person has been, and I use the term that I heard somewhere, WTF, water the flowers.
Yes.
In many instances, we're just out there, we're pollinating, we're watering the flowers, but we don't know which flower we've been on.
Right.
And so oftentimes we don't get good information because, one, they may not know
right.
who they've been with. They know what the person looks like, obviously,
right.
but they may not have any credible information. Maybe the person used an alias. They didn't bother to ask anything about the person's history.
Especially during spring break hookups.
Yes.
Meet a dude from Ohio. You don't know anything about him because you two were intoxicated.
Yes.
So do you have those instances a lot?
We do. Alcohol, drug use, anything that alters your state of mind or being will will sometimes put people in a space where they may do things that they normally may not.
How do you track? So, so if you have someone who tested positive, and like you said, like you guys need to know the information, and they can't tell you who they've exposed, like how does that?
So, whenever we have a new case,
Mm-hmm.
and this is the same in terms of our sexually transmitted infections as well, we have what we call disease intervention specialists, or DIS. Our DIS staff will go out, they will interview that person. They're going to get information. They're going to try to get that person to disclose, basically who you've been with.
Right.
We need that information because we want to get those persons tested too. Sometimes there's situations where a person doesn't know, honestly, that they're transmitting. They may not know they have it. Or it's a case where they do know they have it, and then it's like, okay, well, this person may not be in care, meaning they know they have an HIV diagnosis, but they may not be in treatment.
Right.
And so we want to locate those people, one, because we want to reduce the spread, but we want to also get anyone who had contact with that person tested. And if it's somebody that already has an HIV diagnosis, we want to get them into care, because that's how there's no cure for HIV yet. So the way that we are going to beat HIV is by preventing new cases, people who are already living with HIV, making sure that they are in care, meaning that they're seeing a doctor, that they're taking antiretroviral therapy medications, which will, for people living with HIV, the goal is to be undetectable. That doesn't mean that they're cured. What it means is that the virus is suppressed. The replication of the virus is suppressed in their body. The medication is suppressing the virus. It gives your immune system a chance to rev up and fight back, and that the end result is to be undetectable, meaning you have so little of the virus in your bloodstream that if you took a test, it may not even show up.
That's okay.
Doesn't mean you're cured, but it means that you can live a normal life. You can.
So would you say that early detection is key?
Early detection is key. The earlier that we can identify someone with HIV, the sooner we can get them into care. Because like I said, we want to prevent new cases. And even by preventing new cases, I would love to prevent new diagnoses. And so that is why, in our business, we are very reactionary.
Right.
A lot of the times we get involved once somebody has a case. Well, I'm trying to be a little more proactive. I want to get involved before you get the case.
Absolutely.
Yes.
Now, if I wanted to go get tested today, do I have to set an appointment, or could I just walk into the health department?
Now, we're in the midst of COVID still.
Oh, yeah. Damn COVID.
So, before COVID, you could walk in a place and say, hey, I want to get an HIV test. Now, what we're doing, a lot of our partners are doing, is that sometimes you have to make an appointment to get tested. Some places may let you still come in. I know we're doing appointments largely now, meaning that you schedule a time to come in. Some of our other community partners are doing the same thing. There may be some that are letting people come in and test right then.
Now, would they set an appointment online, or can you call?
You can call. That's the best thing to call.
Okay.
Or you could just come by if you're able to and say, hey, I want to take an HIV test. Because, if they're not that busy,
Right.
hey, we could get you in right then. But if we can't, let's schedule a time for you to come back.
So living with HIV does not have to be a death sentence.
No, I know when AIDS first hit the scene back
Right.
in I think the 80s,
Stonewall riots and stuff,
yes,
right?
people were dying, left and right because they didn't know what it was. People who had an HIV diagnosis or an AIDS diagnosis sometimes were taking multiple pills. I'm talking about 10, 15 different pills. And if the virus didn't kill you, all them pills did.
Right.
So now we have medication regimens that have come such a long way. You can take one pill a day, and that can treat your HIV.
That's awesome. So you guys offer resources for people living with HIV.
Yeah, so here's the biggest thing. If you are someone that has HIV or an AIDS diagnosis, we have a program called the Ryan White Program. That is funding that comes from the federal government to the states, and the state disperses that funding throughout. And we provide services, meaning for people. Let's say if you don't have health insurance, doesn't matter. If you don't have income, it doesn't matter. We partner with several community organizations. We recognized some time ago that sometimes people just don't want to come to the health department. They
Right.
don't want to be seen at the health department. Somebody they know may work there. So what we did was we partnered with community-based organizations like Metro Inclusive Health, like Impact Partners in Care, and AIDS Healthcare Foundation, even USF Pediatrics. We partner with them, and you can go there and see a doctor there. You know, we have a program called the ADAP program, which is a program for people. Obviously, you have to have an HIV or AIDS diagnosis. That is a program whereby we can get your medications for you. The state of Florida has a contract with CVS Pharmacy, so you don't even have to come in the health department to get your medication. You have options. You can go to the local retail store and pick it up. You can do mail order and pick it up. So we're trying to eliminate the barriers. I think we've gone a long way with reducing the barriers. You don't even have to come in the health department to sign up for the program. We'll call you, and you can do it over the phone.
Right.
Yeah.
So there's so many resources that the Pinellas County Health Department offers, and I'm very happy that I'm partnering with you guys, because I'm a resident right here in Pinellas County, and I want to help. What is the word I'm looking for? Not suppress the numbers from going up, or help stop the cases from rising.
Yes. We want to prevent new cases.
Yes.
Yes, we want to prevent new cases. And for anyone out there who has an HIV or an AIDS diagnosis and you're not in care, we want to get you in care.
Yes. So contact, we're going to put the number again and the website where you can go. It's simple. They keep everybody anonymous, right? It's
yes.
No.
We live by the Hippocratic Oath. We do not disclose people's information. If you don't need to know, you don't need to know.
Well, we're going to continue to have these conversations, and, you know, I'm not just going to talk about it. I'm going to be about it too. Safe sex, get tested, stay on my A game. I won't let you down, Darius.
Thank you, Babs.
Thank you so much.